Good day everyone, my name is Christina Sumawang and I am a student nurse from Tarlac State University from BSN 1B, and for today I will be performing a performance evaluation checklist about the genitourinary system. So now we will be assessing the male genitals and inguinal area. So for the purposes of our procedure, it is just like the female genital assessment. So the purpose is to assess for any abnormalities of the genitourinary system. Next is to diagnose for any abnormalities. Next, or any uh, disorders or any diseases of the entire urinary tract as well as the genital tract. And next is to plan the appropriate interventions pertaining to the genitourinary problems. And finally, to evaluate the improvements as well as the response of the client to the management. And next is I will be introducing myself to my client and I need to verify my client's identity. So, good day po sir. My name is Christina Sumawang and I'm a student nurse po from Tarlac State University from BSN 1B. So, for today po sir, I will be your student nurse. May I know your name po sir? Okay, thank you po. So, sir, pwede ko po makita niyo pong wristband? Okay, thank you po. And for today po sir, I will be just, first po is I will be just asking po some series of questions po. I need to determine po the past histories of the client of the following. So, sir, may nararanasan po ba tayong any incontinence po, like leakage po ng ihi? So, wala naman po. And yung urge po ba and frequency po ba ng ating pag-ihi, okay naman po ba? Okay po. And tanong ko lang rin po, sir, if yung pag-ihi po ba natin is, pwede ko po malaman yung inyo pong voiding patterns. Are there any changes po? And yung bladder control po ba natin, kaya pa po ba? Normal naman po ba? Na-hold naman po ba natin? Okay, thank you po, sir. And ask ko lang rin po sana, sir, if there are any symptoms po na nararanasan nyo po, like STD symptoms, sexual transmitted disease symptoms. Wala naman po. How about nakaranas po ba tayo ng inflammations sa ating pong inguinal area which indicates hernia? Wala naman po. And ask ko lang po sana, sir, if may family history po ba tayo ng nephritis? Wala naman po. How about malignancy of the kidney po? Wala rin po. And malignancy po ng prostate po? So, wala naman po. Okay, thank you po. So, gusto ko lang po ipaalala po, sir, na lahat po ng mga questions po and sagot po ng ating pong patient will remain confidential po. Okay po? Okay, thank you po. And for our next step, I need to plan, for my planning phase, I need to plan the proper steps in assessing my client's genital as well as the inguinal area. And after that, I need to assemble my equipment. I do need to have an examination gloves, a drape, as well as a supplemental light if needed. So now we will proceed to our implementation phase. So first thing that I need to do, I need to explain the procedure with my patient, and I need to explain why is it necessary and assess whether the patient has the ability to assist with the procedure or how the client can cooperate. So sir, today po is I will be assessing po yung inyo pong genitals and inguinal area. Okay lang po ba yun, sir? Okay po. So, ang gagawin ko lang po is I will be touching po some various areas of your genitals as well po yung inyo pong inguinal area using my hands po, specifically po my fingers. So, okay lang po ba yun, sir? Okay po. So, it is very necessary po, sir, to assess po for any abnormalities po sa ating pong genitourinary system. And also po to diagnose if there are any disorders po or any diseases po sa atin pong urinary tract as well as genital tract. Okay lang po, sir? Okay, thank you po. And after getting the consent of my patient is after that I will be performing hand hygiene or hand washing and observe other infection control procedures. And after that I will be performing the glovings. So after our glovings, I need to provide some privacy for my client or my patient by closing the curtains around the bed or closing the windows as well as closing the doors to the room if possible. And after that, we will now proceed to our next step, which is I need to position my client to a supine position or a standing position if possible. And after that, I will be assisting my client to a dorsal recumbent position, and I need to flex the patient's knees as well as the patient's thighs externally rotated. And after that, we will be proceeding to the actual inspection. First is we will be inspecting the pubic hair of our patient. So to do that, I will be inspecting the patient's distribution of the pubic hair as well as the amount as well as the characteristics of the patient's pubic hair. So, sir, hawakan ko na po yung pubic hair. Okay po. So, for example, I am looking at the patient's pubic hair. So, for example, there are pubic hair here. Okay, so I will be parting the hairs to inspect the hairs. Okay. Okay. So, sir, based on my observations po, normal naman po ang ating pubic hair. It is not trimmed po and evenly distributed naman po ang ating pong hair sa ating pong pubic area. As well po is there are no presence of any nits and lice po. So there are no presence of pediculosis po. Okay po. And after that, I will be inspecting the skin of the pubic area and I will be inspecting for any inflammations, any swelling, as well as nodules, any lesions like that. So inspect. Again, we will be parting the patient's pubic area to see to inspect the skin. Okay. So, sir, normal naman po ang ating pong skin sa ating pong pubic area. So, wala naman pong any presence of any inflammations, any swelling po, or any nodules po sa ating pong area. Okay po? Wala na po kayong dapat ipangamba. Okay po? So now we will proceed to the inspection of the patient's shaft as well as the glands of the penis. So first, I will be inspecting the penile shaft for any and glands penis for any presence of inflammations, any swellings, any lesions, as well as nodules. So first, inspection. Okay, so sir, based on my observations po, there are no presence of any inflammations po, any nodules, any lesions, and swelling po. So, wala po kayong dapat i-worry doon. And next naman po is I will be inspecting my client's urethral meatus, which is located here, which is the hole here. And we will be inspecting for any inflammation, swelling, and discharges. So, inspect. Okay, so, sir, wala naman po tayong nakitang any inflammations as well as discharges po and swelling po sa inyo pong urethral meatus. Okay po? And after that, I need to compress or ask my client to compress his or his glands slightly so we can so that the urethral meatus is open, and we will be inspecting the urethral meatus for any discharges. So, okay, compress. Okay. So, if the patient reports any discharges, we will need to ask our client to strip his penis at the base to the urethra. And after that, we will be palpating the patient's penis for any tenderness, thickness, and nodules. And to do that, we will need to use our thumb and our first 3 fingers. So, we will be palpating the patient's penis. Okay? Sir, I will be palpating na po yung inyong pong penis. Okay lang po? Thank you po. Palpate. 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 Okay, thank you po. And after that, we will now proceed to our next step, which is the inspection of and palpation of the patient's scrotum. And to facilitate the inspection of the scrotum during the physical examination, we will need to ask our client to move away his penis. So for example, I have asked my client to move his penis away. So here's an example. Okay, so that the scrotum is exposed and ready for the physical examination. First is I need to inspect the appearance as well as the general size and the symmetry of the patient's scrotum. So, need to inspect. Okay. So, based on my observations po, sir, medyo mas lightly dark lang po yung ating pong scrotum dahil po sa rugated surfaces po natin. And yung general size naman po is normal for your age po. Okay po. And yung symmetry po, which is yung left side po ng ating scrotum, which is hanging lower po ng konti kaysa po sa ating right, which is normal po. Okay po. Thank you po. And for our next step, I need to inspect the skin surfaces of the scrotum by spreading the rugated surface areas and lifting the scrotum as needed for the inspection of the posterior surface of the scrotum. So, for example, I have spread the rugated area, the curved areas on the skin. I have spread it to flatten it a little bit. Okay. So as I have spread, and I need to lift the scrotum so I can inspect the posterior surface of the patient's scrotum. So, example, I have already lifted the patient's scrotum. Okay, thank you po, sir. And after that, we will be proceeding on the palpation of the patient's scrotum and to assess the uh, status of the testis, as well as the epididymis and the spermatic cord. And after that, I will be inspecting the patient's testis by palpating it, and by uh, by palpating it, and simultaneously for the comparative um, purposes. So, for example, I am palpating it lightly, gently. Okay, thank you po. And after that, we will now proceed to the inguinal area of our patient. So to do that, I will need to uh, inspect both the inguinal areas of my patient, and I need to inspect for any bulges while the client is standing if possible. So, for example, again, the white part here is the patient's inguinal area. First is I need to inspect my client, or ask my client to uh, relax, or to keep calm. And after that, I will be asking my client to um, take a deep breath, and I need to ask him again to hold his breath and strain or bear down, as though having a bowel movement. Okay? So sir, relax lang po natin ang ating pong katawan. And sir, pwede po ba tayo mag-breathe in and hold po natin yung breath natin ng sandali? Okay po, as I inspect po yung inyo pong inguinal area. Okay po. And after that, let's assume that the client already breathed in and hold his breath. We will now be inspecting the client's inguinal area. We need to palpate it as well. Okay. And we will be inspecting for any lymph nodes, any inflammations, hernias, and if we are done. So, sir, based on what I have inspected po and palpated, there are no any presence po of lymph nodes, any hernias, and inflammations po sa inyo pong inguinal area, which is good po. Okay po. And after that, we will now proceed to the documentation phase. So first thing what we are going to do is we will be documenting our findings to the client's record. And for our evaluation phase, we need to remove our gloves if worn. And after that, we need to perform hand hygiene or wash our hands and observe other infection control procedures after our procedure. And after that, we need to reassess our patient for any discomforts, and if there are any problems occurred after the assessment of the performed assessment, or while performing the assessment of the genitourinary assessment, which includes the inspection of the genitals and inguinal area of our patient. And that would be all for the assessment of the patient's, the male patient's genital and inguinal area. Thank you.